paper that you did that showed that adolescents and young adult males, 15 to 39, there's a 20% incidence of testosterone deficiency in that population.
Right.
I think that was the first paper that opened my eyes, because I kept saying, at one point in my practice, we said we're not going to treat anybody below 30. When I saw your paper, I'm like, no. Those 20-year-olds are suffering. We need to find a way to help them.
As a urologist and as a reproductive urologist, we started seeing a lot of young people with low testosterone. It was very hard for me to put hypogonadism and adolescents and young adults. And so we did a cross-sectional study of NHANES, which is basically a database of all basically adolescents, young adults, the entire US population. And we found that the level from 1999 till 2015 has basically declined from like 600 to about 450.
Wow.
Still in the normal range, but you have to understand the median in 18 to 39 was 450. That means 50% of the population between to 18 to 39 has less than 450.
That's incredible.
50%.
15%
have less than 450. And so if the numbers keep going down in the population as a whole, of course the normal levels are going to go down.